Hey, future medics. Today we're continuing the axial skeleton and we are breaking down the most important body part when it comes to trauma care, and that is the spine. So we're going to go through it because if you know how it is all fit together, you'll know how to protect it and why spinal injuries are nothing to mess with. So the spine is made up of 33 vertebrae, which are divided into 5 regions. So here we've got the base of the skull, okay? So purple, you've got your cervical spine. These are your cervical vertebrae. There are 7 of them. Blue is your thoracic, and there are 12. Green here is your lumbar spine, and there are 5 of those. And then if you look at the back of the pelvis here, I've got the nerves coming out from each one, which is important and we'll get into, but it kind of makes it look like a dragon back here. It's kind of crazy. This orangey yellow here is the sacrum, and it is 5 bones. And then the coccyx here is fused together, your little tailbone here. It's 4 fused bones. The spine has 3 main jobs, and that is to protect the spinal cord, to support weight of the body, and that's why you'll see as you go lower down, the body of the vertebrae get wider because they're supporting more weight. So these little cervical vertebrae, pretty small, but when you get down to these lumbar, you can see that they're much, much bigger than the cervical vertebrae. It's because it is supporting more weight from the body. And the third is to allow for movement. Now, let's talk about the cervical vertebrae. So this is the base of the skull. The base of the skull sits on top of the cervical vertebrae, and the first 2 are incredibly important. They actually have their own name. C1 is the atlas. In the atlas, the skull, let's see if you can see it. The skull sits directly on top of it. So it sits like this, and the skull sits directly on top of it. Now, C2 is the axis. And what happens is it has a bony protuberance like this that goes straight up, and it's called the dens. And it goes up inside of the atlas, and it allows us to be able to move our head because otherwise we would just go back and forth. But being able to do this, you can actually rotate around. So those 2 are really important. Now the cervical vertebrae are incredibly important because we have a lot of very important nerves here, like the phrenic nerve, which innervates the diaphragm. And the higher up the damage to the spinal cord, the higher a person is paralyzed on their body. So this is really, really important for us to check and make sure that there are no injuries to this area. Looking at more anatomy of the spine, on the back here, you've got the spinous processes. They are bony projections that come out that support ligament attachment for muscles. Also, from the sides here, you have these bony projections that are the transverse processes, and this is the body of the vertebrae. Also, in between, we've got these intervertebral discs, which are little cushiony shock absorbers. But I want to talk about these nerves that are sticking out. They correspond with the vertebrae that they come from. So the cervical spine actually has 7 bones, but it actually has 8 cervical nerves that come out. And in the cervical spine, the nerves come out by these transverse processes because there's a little space, and it comes out above the corresponding number of the cervical vertebrae. But the thoracic and the lumbar, these little nerves come out below. So the first thoracic nerve is actually this guy right here that is below this first thoracic vertebrae. But you'll see we've got, you can't see, there's an extra here, and C8 is actually right here because it comes out from below C7, and then T1 comes out from below the first thoracic vertebrae, and so on and so forth. And so these little bony projections allow for these nerves to be able to go out and then run to the extremities and innervate them so we can move, which is important because these things can get pinched with trauma. And whenever you're talking about nerve pain, it's usually characterized as a shooting pain. Hurts a lot, and it usually shoots down the appendage. When we're dealing with trauma, your first thought should be, is the spine involved? Because we might have a spinal cord injury. So these are a few things that should give you a very high index of suspicion. Diving accidents, falls from great height, very high velocity motor vehicle accidents, especially when people aren't wearing seatbelts. Axial loading. I see this a lot in football games where they lower their head and they spear tackle someone. It really loads that spine. It's really, really dangerous. Now, here are your red flags that there is a problem. When someone has numbness and tingling in their fingers and any of their appendages, problem. When there's neck or back pain, or you're feeling down those spinous processes and you feel a deformity, problem. When anyone is having unilateral numbness or tingling, problem. We should do our best to use a seat collar, use a backboard, and spinally immobilize those people, because we would hate for them to have a vertebral fracture and those tiny little bone shards to be able to shear any of that spinal cord, because it might never heal, and that will really affect our patient's life. We've now covered the skull, the face, and the spine, so that only leaves the thoracic cage, and we'll be done with the axial skeleton. So next we're going to talk about rib fractures and why they can be a lot more dangerous than they seem. You are doing a really good job. Little by little, building layer by layer builds mastery. And returning to it time over time, it's going to stick. You're doing great. And I believe in you. Even if you don't believe in yourself right now. Stick with me, you'll be fine. I'll see you soon.